Great to be here with you today. One of my favorite topics, CBD. So my job is to kind of kick everything off for us today and talk a little bit about what is CBD, and let's get grounded in the basics of this fascinating and really promising compound. So most people have heard of THC. I'm sure everybody at home and in this room has heard of THC, but more and more people are talking about CBD. And that's why we've brought together an all-star cast today to tell you what the buzz is all about, what you should know, what to look for, a survey of the current research, and ultimately how CBD, known as cannabidiol, can become a meaningful part of your own wellness regimen. What is CBD? You know, CBD is a lot of different things. It's a constituent of cannabis. Like THC, it's also a cannabinoid. More specifically, though, CBD is what we call a phytocannabinoid, meaning it was derived from the cannabis plant as compared to endocannabinoids, which are actually made naturally in our bodies. The relative amount of CBD as compared to THC that's found in a plant is the result of its genetic makeup, so that defines those relative amounts. In the plant, CBD is mostly in the acid form, so there's CBD acid and CBD. CBD acid, once it's heated, transforms into CBD. So when you put that flame to your pipe or the heat to your vaporizer, you're actually doing chemistry, converting that CBD acid to CBD. In the plant, CBD acid is made from CBG acid, which is also the same precursor for THC acid. So you can start to see some of the common pathways in the plant that these things are made from. But ultimately, THC and CBD have very different properties, and we'll talk a bit about that now and a lot more in depth throughout the day today. There's basically three types of cannabis. So all cannabis falls into one of these three buckets. You have THC dominant cannabis, you have CBD dominant cannabis, and then you have cannabis that has equal amounts of THC and CBD. Until about the last 7 or 8 years, CBD dominant cannabis was really rare. It was really difficult to find. But it's proliferated under more demand for CBD cannabis as people have focused on the breeding and developing of new strains with unique amounts and ratios of CBD relative to THC. So there's been a lot of effort to help create these strains and make the genetics available so that people can grow them and a lot of people can receive the benefits from them. It's the more that we know about CBD, all these exciting properties we find out about it, that's getting people so excited to put all this energy into making more and more strains. So why are people talking about it? CBD is creating a lot of buzz because it's effective in providing relief from a number of different issues that really affect the quality of life of millions of people. Basic things like pain, anxiety, depression, GI disorders. How many of us have trouble with our stomach? I'm just about 40, I know I do. In addition to these things that are really quality of life issues for millions of people, CBD has also shown promise as a therapeutic agent for really difficult to treat conditions. Things like epilepsy, especially juvenile epilepsy, Parkinson's, ALS, multiple sclerosis, fibromyalgia, schizophrenia, bipolar disorder. These are things that classically pharmaceutical solutions have been challenged to effectively treat over the long term. That's one of the things that is the most exciting about CBD when we look at the landscape of options for people who are dealing with issues like sleep, like anxiety, like depression, like pain. Many of the things that they have to take, pharmaceutical or OTC, have unwanted side effects. I think a really good example is SSRIs, things like Lexapro and Prozac, Wellbutrin. A lot of people in our society are on them. I'm not quite sure what the percentage is, but it's very high. I was once prescribed an SSRI, and at the end of 5 years, I had a lot of different chronic diseases. And I started going to a lot of different doctors to figure out what was wrong with me. Why did I have fibromyalgia? Why did I have sleep apnea? Why did I have all these things? And the first doctor I went to said, well, Samantha, first we need to know all of the drugs that you're taking so that we can start to see if you're having any interactions. So I told her I was only taking one thing. And she said, well, Samantha, there's your problem. And I said, what are you talking about? And she said, well, Samantha, SSRIs disrupt REM sleep. So you haven't had any REM sleep for 5 years. So you have IBS and fibromyalgia and all these other chronic conditions. Now you can't make a direct correlation, but it's the context of these things and the overall kind of detriment to your body that often these things can create a situation that's worse than the original issue you were trying to treat. So CBD is one of the only non-toxic therapeutic alternatives that people can take for these issues. So while providing all of these benefits, CBD doesn't have these detractions. And unlike THC, it actually doesn't cause any impairment, making it a really attractive option for people who are seeking to really reap the benefits of cannabis therapeutics but aren't interested in experiencing feelings of impairment or they're concerned about it. When you're thinking about using cannabis and exploring CBD for the first time as part of your wellness regimen, you'll really want to consider several different aspects of what are your priorities, what are you trying to accomplish. One thing you need to consider is what's your tolerance for feelings of impairment. That's really going to help drill down on what's the amount of THC that you can tolerate relative to CBD. Because we need to talk a lot about how CBD and THC work together to help achieve your desired outcome. Because it's not just about CBD, it's about CBD working in synergy with all of the different compounds in the cannabis plant, THC being one of many. A given flower has about 100 active ingredients in it of the hundreds that could possibly be in there. We'll talk about what kind of use you're comfortable with. There's a lot of ways to take cannabis and CBD. You could take it by capsule, by pill, by edible. So we'll talk about a lot of those different delivery systems. You also need to consider source material. You'll hear talk about hemp versus cannabis-derived CBD. It's an important conversation, and people need to understand the distinctions so they can make the right decisions for them. And it's also good to know what's the latest research on CBD so you can know how it's applicable to the things that are affecting your life or the wellness of your loved ones. So let's talk about how CBD reduces impairment from THC. CBD and THC really work together in the body to maximize benefits. CBD actually regulates the CB1 receptor that THC binds to. When CBD binds to that CB1 receptor, it causes it to hold on to THC a little less tightly, so that binding isn't quite as tight. That allows THC to move away from that receptor more easily. And when THC moves away from that docking site, those feelings of impairment and the effects of THC start to cease. So that interaction of CBD with the receptor that THC binds to is what lessens the feelings of intoxication from THC when taken in combination with CBD. So remember, when those docking sites can't hold on to THC as long or as tightly, the effects of impairment are lessened. So the take home is that CBD can actually help reverse the effects of THC if you've had too much and you feel like you've overdone it. So CBD can be an important tool in the toolkit of people who are also pursuing THC therapeutic regimen, especially if they're new to it. So if you overdo it and you feel like you've had a little too much and maybe you're experiencing some anxiety from the THC, a little dose of CBD can really help bring you back down to earth and to your center. So it can be a really valuable tool, say for a parent or a loved one who's not familiar with cannabis and they're going to try it for the first time. It's good to have that safety net just so everybody has a good experience. Because the thing is that we don't want people to have a bad experience with their first therapeutic use of cannabis. It's one of the worst things I can imagine to have somebody turned away from the only non-toxic therapeutic alternative that they have. So it's important that we give them all the tools for success. Ratio. You hear that word a lot in the CBD space. Ratio. We all know what ratios are. Well, we all had some math at least. We're talking about the relative amounts of THC and CBD. This is referred to as the ratio. For example, you'll hear people say 20-to-1 CBD cannabis. What does that mean? They're saying that that cannabis has 20 times the amount of CBD as compared to THC. So why do we care about ratio? Why is everybody talking about this? So for a couple reasons. That ratio value is used by a lot of people to identify CBD cannabis that's the most applicable to their given ailment. So in the research that's been done to date, as well as a lot of patient anecdotal evidence, we see that particular ratios work very well for certain conditions. So for example, for juvenile epilepsy, a lot of the parents who are treating their children say that they need a 23-to-1 CBD to THC ratio to effectively stave off those seizures. Now, in contrast to that, there's other parents who actually use a 4-to-1 ratio. So it also is very specific to the biochemistry of the patient and of their disease. Ratio also matters when we're considering feelings of impairment. So some people are concerned with finding as high of a level of CBD as they can relative to THC because they're really looking to avoid feelings of impairment. But also, in some cases, THC can actually exacerbate some of the issues that CBD is used to treat. In some cases of juvenile epilepsy, again, some parents report that when the THC dose is exceeded a certain threshold, it actually seems to induce additional seizures. Anxiety is also another one where CBD is often used to treat anxiety, and THC can, for many patients, exacerbate anxiety. So in those cases, you see patients really focusing on ratio to maximize that amount of CBD and minimize the amount of THC, so it's appropriate for the application of their therapeutic regimen. You know, this relationship with CBD and THC continues to be dynamic and more complex the more and more we learn about it. Another thing we know about the interaction between CBD and THC is that CBD actually prolongs the benefits of THC. You say, well, wait a minute, Samantha, just a few minutes ago you said that CBD can actually lessen the feelings from THC. Well, I was talking about feelings of impairment when I said that CBD can actually lessen those feelings of impairment from THC. But interestingly, it can also extend the therapeutic benefits at the same time. So how is that happening? Well, once THC is no longer bound to that CB1 receptor, that docking site, it then travels through our bloodstream to our liver. And in our liver, it's going to encounter an enzyme that wants to break it down, and then we'll eventually excrete it in our urine and our feces. So CBD actually inhibits the enzyme that breaks down THC in our liver. So in that case, rather than making it to our liver and being broken down, that THC may recirculate, find another CB1 receptor, dock in it, maybe not as tightly, before it actually makes it to the liver for eventual breakdown and excretion. So in that way, CBD prolongs the benefits of THC. So together, they work together very well by both reducing the impairment from THC so you can perform at your peak while, say, you're executing a wellness regimen that you need throughout the day, so you can still be a top performer, as well as allowing those therapeutic benefits to persist longer. So you can see a very natural and very synergistic marriage between the two. A lot of different ways that you can take cannabis. If you've ever stepped into a dispensary, you've probably been overwhelmed by the display of all of the different manufactured products, let alone the flower and the concentrates. I mean, how many different types of concentrates are there these days? I don't even know if I know all of them. There's keef and water hash and shatter and BHO and CO2 extract, and there's all kinds of different things. So it can be a little bit overwhelming. So one of the things you need to think about is what kind of mode of ingestion or taking CBD or cannabis is comfortable for you. You can smoke or vaporize CBD flowers or concentrates. There's capsules and tinctures. There's topicals and edibles. There's tablets. There's candies. Almost anything that you can imagine putting in your mouth or inhaling, it exists, so to speak, in the cannabis space. So one thing to consider when you're choosing, say, between an inhalation method and an oral ingestion method is the time that you're going to experience those benefits. So on inhalation, you're going to feel the benefits of the cannabis that you consume almost immediately. So it's taken up in seconds and located in all those receptors throughout your body. Taking it orally, you'll have a longer duration for onset, so it's going to take longer for you to feel it, but will also last longer. So if you need to have your therapeutic regimen have a very long period of time before redosing, then oral ingestion might be a good idea for you. Also, it doesn't have to be one or the other. It doesn't have to be I do inhalation or I do oral ingestion. It can be a combination of the two in a regimen where when you're having an acute day, maybe use inhalation for immediate relief, but your day-to-day is a regimen of an oral ingestion to keep the overall level of your symptoms down. So I said you need to consider the source of CBD. You know, as CBD is becoming more and more mainstream, thanks to people like Sanjay Gupta on CNN, who really brought the mainstream focus and shine a light on what was happening, some of these things that people are calling miracles, because they are causing such an enormous shift in the quality of life of the patients who are taking it. So as CBD has come into the mainstream, of course you have a lot of people who are interested in it and taking it, and a lot of people are interested in making money off of it. And so with that comes a lot of complicated behavior and a lot of things for the consumer to sort through. I think that's one of the reasons why we're here today, is to help the consumer kind of sort through all of the stuff that's in front of them. So there's a lot of talk about CBD from hemp-derived sources versus cannabis-derived sources. So CBD derived from hemp, CBD derived from cannabis, and synthetic CBD are the different types of CBD that you'll encounter on the market. CBD from hemp versus CBD from cannabis is probably causing the most controversy in the discussions that are happening. The synthetic is really still viewed with a high level of skepticism, and probably should be, until we understand more what else is contained in those extracts, et cetera, as they're not 100% pure. So when something isn't 100% pure, there's something else in there. So we need to understand the safety of those, which is not as obvious and as direct of a path as talking about hemp and cannabis-derived CBD, which are plant-based. The important thing to take away from this conversation about source, about hemp versus cannabis-derived CBD, is this, is that CBD is CBD is CBD. The chemical compound isn't different between the two sources. Now there's a lot of different, what we call isomers of CBD, and you can have different isomers of CBD, but structurally they're the same. Isomers are things like mirror images of a compound, or you may have things where the hydrogen is in one different position than another. But ultimately, CBD is CBD is CBD. So what's the difference about CBD in these two sources? The difference is everything else. All of the stuff that's co-extracted, right? So all those other co-extracted compounds work synergistically with cannabinoids, like terpenes and flavonoids. All of those things are found at lower levels in industrial hemp. So the context of CBD from industrial hemp is not as rich and complex as the context of CBD that's derived from cannabis. So the richness of that context comes through in the extracts as well, all these co-extractables. So I hear a lot of people who want to say one is good and one is bad. I was sitting in that camp as well, until I had a couple of aha moments in doing forums like this, where I'm speaking to patients and I'll make a statement that something is, and somebody will raise their hand and tell me, you know what, Samantha, that's not the way it is for me. And cannabis is like that. And we have to leave room for that. It's one of the things I try to teach patient consultants is, as soon as you say, this is what this cannabis does for me, you're gonna have somebody tells you it's doing the opposite for them. And you can't discredit their point of view or their experience. That has to do with the different ways that cannabis affects people based on their biochemistry. You'll hear that referred to as the biphasic effects of CBD. So that means that you may have the completely opposite reaction to CBD that I have. So in that case, it's really important that we focus on what is working for patients. So as I was going down the path of saying it has to be cannabis-derived CBD, I did a panel with somebody who said, the only thing that works for my children who have a terminal disease is hemp-derived CBD. And it was fascinating. I spoke to her in depth afterwards, and she said, it's absolutely the truth, Samantha, that cannabis-derived CBD doesn't work for my kids, only the hemp-derived. So nobody really knows the reason why. And I've had several anecdotes like that since then. So it's made me reevaluate what's my own position and understand even further, as I see more and more of the research that's coming out. There's some fascinating research happening at Technion Institute in Israel right now, where Dr. Dedi Meri is doing analysis on cannabis, where he's actually looking at every terpenoid and every cannabinoid in a given flower. And what we're seeing in his work is that the diversity on one plant, between the different flowers on one plant, is so enormous that we can't say even that this batch of Jack Herer does this for me, because one flower on that plant may do something different than another flower on that plant. The diversity in cannabinoid expression is that great, even on the same plant. So it's this research that really pushes us forward with CBD. It's what's driving the momentum, especially when we start to look at these really difficult to treat diseases or things we just haven't been successful treating. Epilepsy is one of them. It's probably one of the disease states that's driving the most momentum in CBD today. There's a population of kids with an intractable form of epilepsy where they have an incredible number of almost an unimaginable number of seizures every day. I got a call from a fellow one night who was in Florida who had been referred to me for information to try and help his daughter who suffered from this type of epilepsy. And when he called me, I always remember this moment. For some reason, it was it's always fresh in my mind. And I remember I could hear the sounds of him making dinner in the background. I could hear the family chatting and laughing. And he starts to tell me the story of how his 4-year-old daughter has 800 seizures a day. And if you do the math, that's one every minute or so. And as he said this to me, I started doing the math as he's talking to me and realized what this meant, that this child was in a constant seizure. She had no quality of life. She had no emotional interaction or relationship with her family. And he said, Samantha, I really need some help, and I was told that you could help me. I really need to get some CBD cannabis. I said, well, I want to help you. I can give you information. There's not a lot of help I can give you necessarily because you're in Florida and I'm in California, and that's a big barrier in terms of how our federal government looks at it. I said, but I can tell you what to look for. I can give you some strain names. I can send you in as true of a direction as possible. So the phone call ended, and I was really disappointed. I wanted to do more for him. I couldn't. So about a month later, he called me back, and I was really glad that he did. And he said, Samantha, he's like, I really have to share this with you. He's like, I found some CBD cannabis here in Florida, and we're giving it to my daughter, and she's down to 1 seizure a week from 800 a day. She could talk. She could speak. She had emotional intelligence. She could connect with her family and her peers. For that family, that was everything. And he actually called me back again and told me she was down to 1 a month. It's those kinds of shifts in these extraordinarily difficult disease states that are making people say, hey, why would we ever make something like this illegal? Why would we restrict access to this? It spurred the advent of things like CBD-only laws in various states. Hey, we'll take what we can get, right, in the cannabis industry. If you want to say CBD only, we'll take it. So these difficult-to-treat diseases are really causing a lot of interest also in higher-level research. I think traumatic brain injury is probably one of the areas I've seen the most formal research on in the last few months. I went to a research conference at Harvard Medical School. That was a cannabis research conference. How cool is that, right? And another one in Israel recently where we were talking a lot about traumatic brain injury and how cannabinoids, CBD in particular, can help stave off traumatic brain injury, both taking it in advance of when the injury happens and even taking it post-injury. You see an enormous reduction in the number of cells and the permanent damage that's done to the brain. It's amazing when you start thinking about high-impact sports like football. You see a lot of NFL players coming to the table right now, talking about CBD and THC. It's an exciting time, and there's a lot of things that are so meaningful and causing such a huge shift in people's lives. It's no wonder we're here talking about it today. Graft-versus-Host Disease is another one where there's quite a bit of research happening internationally, some in the US as well. This has to do with things like transplants and the acceptance of transplants of patients. And CBD is doing incredible things in helping ease this aspect of some forms of treatment. That's a lot of stuff that CBD does. So how does it accomplish all of that? CBD affects all of these aspects of our health and wellness by interacting with a natural system in our body called the endocannabinoid system. You can think of it as a network of docking sites in your brain, literally docking sites in your brain, where CBD and THC interact with them. They affect and balance our biochemistry and support our overall wellness in this interaction with this endocannabinoid system. You'll often hear it referred to as the ECS. That natural architecture, that endocannabinoid system, is why we react so strongly to cannabinoids in our body, right? Because we have that natural architecture to interact with them. It's also, interestingly, the reason why when we consume them, they're not seen as toxins by our body. We have a natural system to interact with cannabinoids, and we produce them naturally in our own bodies, as I mentioned earlier. In the case of pharmaceutical and over-the-counter drugs, when you take those, your body actually sees them as a poison. It deals with them very differently. When your body sees something as a poison, it stops everything else it's doing. It focuses on that toxin to break it down and get it out of your body as quickly as possible. That process of the isolation and the breakdown and the different byproducts and things that happen as a result of this are one of the things that contribute to the different side effects that people experience from pharmaceutical and over-the-counter options. In many cases, people are seeing side effects that are having an impact on their professional lives, their family lives, that in many cases are actually worse than the original condition was to begin with. I think of opioid addiction. Right? So many people's lives have been affected by that as there was a shift in the prescribing behavior of doctors several years ago. The number of people who are addicted to opioids and suffering from the effects of that addiction, their inability to work, the damage to their personal life, is really overwhelming. You can also have disruption due to erratic behavior. I think we all have some interesting stories about people taking sleep medications at this point. You know, and the kind of strange behaviors that are very disruptive to people's lives. I've heard of people getting their children taken away because of their behavior on sleep medication. So that lack of quality of rest can also lead to other health issues. So as you can see, CBD has a wide array of activities and benefits, and it really offers a lot of promise to people who are dealing with detriments to their overall wellness and quality of life, as well as people who are dealing with truly difficult to treat diseases that don't have a lot of hope. So we're going to bring you a comprehensive look at CBD today. The next speaker after me, Martin Lee, is going to take a deep dive into the ECS and help you understand how all those receptors and compounds interact with one another. We're going to explore the topics that are important to consumers that they're concerned with and need to be aware of. We touched on some of them here in my talk. We're going to do a deeper dive in all of those areas. You're going to walk away today being a CBD expert yourself. We're going to give you the facts to know what ailments it's appropriate for, more on current research, a discussion around the merits of cannabis versus hemp-derived CBD, and the consideration about the many ways you can take CBD. So I'm excited to be a part of this great forum today, and it's a really just a great opportunity to share all of these amazing benefits of CBD with the Green Flower audience. Thanks, guys.